All right, welcome back to class. We are going to begin CPR training. So we'll follow along through these PowerPoints. And if you are looking to get your CPR instructor or CPR certification, you will need to schedule a time to come in to do the actual skills training. So we'll go ahead and get started. So recognizing and responding to an emergency. In an emergency, there are 4 actions you can take to make a difference in the outcome for an injured or ill person. We want to be able to recognize that emergency exists. We want to decide to take action. We need to activate EMS, the emergency medical system. And then we need to finally give care consistent with our knowledge and training until EMS personnel arrive and take over.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though. You think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. I'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
All right, so now watching a video on responding and recognizing to an emergency with a child.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. I think we should break out some scooters on the way to work.
I can definitely see you breaking something on one of those.
Yeah, you're right. Hello? I gotta get to the office.
Me too.
All right. Yeah. I'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Joey, are you okay? Help! Someone help my son, please! Joey, are you okay? Oh.
Joey, are you okay? Joey, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have those at the store. Joey!
It's okay, ma'am. He's on the phone with 911. Did you see your son fall?
It all happened so fast, I'm not even sure what happened.
Did anyone else see what happened?
Yeah, I saw the whole thing. He just collapsed out of nowhere.
Was your son complaining about not feeling well earlier today, or?
He said that his stomach hurt. I said we shouldn't go, but he really wanted to ride his scooter. I should have made him stay home.
Does he have any allergies?
No, he has no allergies.
Thank you so much.
Okay. So looking at those 2 videos, what alerted bystanders to the fact that an emergency was occurring? Something to think about. What other observations might signal an emergency? And what were some of the bystander roles depicted in the video segment? Okay, so obviously, thinking about it, having an individual down on the sidewalk, being unresponsive, would obviously signal potentially an emergency. Someone screaming help, also going to signal that emergency. And what were some of the bystander roles? So the person in charge there, the one who took charge, told one person specifically to call 911, told another person specifically to go get an AED and first aid kit. Okay, so that is real important in these emergency situations that you delegate work to specific people. So at the scene of the emergency, deciding to take action is not always as simple as it sounds. Why might someone be hesitant to respond to an emergency? Give you guys a second to think about that. So a couple different reasons. They may be nervous about their training. They may be nervous that they would do the wrong thing. Oftentimes when there's a group of people, no one necessarily wants to be the one to kind of step up and take charge. So these are all kind of reasons that people may be hesitant. It is important to note that lay responders are rarely sued for helping in an emergency. Again, we had touched on this briefly. Good Samaritan laws help to protect people who voluntarily give care in an emergency situation. If possible, you do want to try to obtain consent before giving care or give care to according to your level of training, and do not stop care until EMS personnel take over. So deciding to take action in a first aid situation, your decision to act could be the difference between life and death for the person who needs help. The rapid arrival of EMS personnel greatly increases the person's chance of surviving a life-threatening emergency. So we want to activate EMS by calling 911 or the designated emergency number for any life-threatening condition. So what are some examples of life-threatening conditions that you could think of? So we talk about life-threatening conditions. We are talking about unresponsiveness, potentially an altered level of consciousness, potentially breathing problems, severe external bleeding or vomiting, or passing of blood, and signs of symptoms of a life-threatening medical condition such as a heart attack or a stroke. Could also be talking about severe or critical burns, suspected or obvious head, neck, or spine injuries, suspected or obvious broken bones, a suspected poisoning that appears to be life-threatening, as well as seizures. So again, talking about giving care until EMS takes over. Before we give care, if at all possible, we want to obtain consent. So we tell the person who we are, what type and level of training we have, what you think is wrong, and what you are planning to do. If the person is a minor, we would like to try to obtain consent from a parent or guardian if they are present. So in the possibility that the person is unconscious, consent is going to be implied if they are unresponsive, confused, or mentally impaired, or if they are a minor with a life-threatening condition and the parent or guardian is not present. If a person who is awake and alert does not give consent, do not give care. Call EMS personnel if you believe the person has a life-threatening condition and needs care. Okay, so if they do not give consent and they are awake and alert, you cannot provide care. It would be a good idea to still call 911 in that type of condition if you believe it necessary.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the shoulder for an adult or child, or the bottom of the foot for an infant, and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step: call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
Okay, so when talking about emergencies, we want to check, call, and care. So before rushing to help, we want to size up the scene and form an initial impression. So is that scene safe? We want to use our senses to gather information that will help us determine whether the scene is safe to enter, what happened to cause the emergency, how many people are involved, what condition the person is in, and whether anyone else is available to help. As part of your scene size up, we want to form an initial impression about what is wrong with the person. So does this person appear ill or have any immediately identifiable injuries? Are they moving or are they motionless? Do they have signs of a life-threatening illness or injury? So do they have trouble breathing? Is there severe bleeding that's readily apparent? So based on our scene size up and initial impression, we may decide to go ahead and call 911 or the designated emergency number, may decide to obtain equipment such as an AED and first aid kit. We may also decide to provide immediate care for severe life-threatening bleeding. Is the scene safe? If not, what are the potential hazards? What do you think happened? This is an activity that we may do in class. If you're online, I wouldn't worry about it too much. Things that are important to think about, though: how many people are involved? What's your initial impression? Is anyone else available to help? Should EMS be summoned? If so, why? So looking at these pictures here, is this initial scene safe here? No, probably not. Again, we can see what looks like a chemical spill. We have multiple people who appear unresponsive, likely due to that chemical spill. So in this case, what would you do? So in this case, we're probably not going to enter the scene as it is unsafe for ourselves. However, we would call 911 to get them there, identify kind of the scenario for the EMS, and then try to keep everyone else clear of the area. So looking here, we see that we have a pretty apparent leg bleed, also appears to have some blood on his forehead. We do have another individual here that could potentially help out. So in this case, the scene appears to be safe, assuming that drill saw is shut off. We would need to control that bleeding immediately, depending on how severe the bleed is. May need to call 911 in this scenario, and could probably have this individual go to get a first aid kit or something to help control that bleeding. Okay, and in this individual, again, it appears that the scene is safe. You may not know what is in that individual's other hand, but he does appear unresponsive or unconscious for whatever reason. So you would go try to assess his consciousness, see if you can wake him up. If not, you would probably need to start the 911. So call first or care first. Which one are you supposed to do first here? So if you're alone and there's no one to send a call for help, you may need to decide whether to call first or care first. We want to call first when we suspect some type of cardiac arrest. So anything involving the heart, we need to call first because, again, getting an AED and EMS on site is going to be that person's best chance of survival. In situations in which we have breathing emergencies, such as choking or life-threatening bleeding, we need to care first. So we provide care first, try to get whatever the condition is manageable, then we can go ahead and call. So just kind of the distinction there. So we'll also call first for any person about 12 years or older who is unresponsive. We will call 911 first for a child or infant who you saw suddenly collapse. We will also call first for an unresponsive child or infant who is known to have heart problems. However, we are going to care first for an unresponsive infant or child younger than 12 years who you did not see collapse. So you are unable to determine how long they have been unresponsive. We will care first for a person who is choking. We will care first for a person who is experiencing a severe allergic reaction, known as anaphylaxis, and has an epinephrine auto-injector. We will also care first for a person who has life-threatening bleeding. So we do want to try to lower the risk for infection. We can do so by using personal protective equipment, known as PPE. This can help to lower the risk for getting or transmitting an infectious disease when giving care. Latex-free disposable gloves and CPR breathing barriers should also be included in first aid kits. There are also small little ketane kits that may contain gloves, breathing barriers, or both. So, checking the responsiveness of a person. We use the acronym SAMPLE, just as kind of a run through of what we need to determine. So S for signs and symptoms. A is for allergies. We need to ask about allergies if they're responsive. M going to be any medications they're taking. P is going to be their pertinent medical history. L is going to be their last food or drink. What do they eat or drink last? And then E finally is going to be the events leading up to the incident. So sample is what we are using to assess a responsive person. Questions we ask a responsive person. So after interviewing them, again, using that sample acronym, we want to check the person from head to toe. We'll tell the person what we are going to do before we begin. We want to avoid asking the person to move if we believe that the person has a head, neck, or spinal injury. We also want to avoid asking the person to move any body part where he or she is experiencing pain or discomfort. So we want to move straight down the body and then check the arms, the head and the neck, the shoulders, the chest, the abdomen, the hips, the legs, and feet, and finally the arms and hands. We want to check each of these body parts one at a time. So what should you look for as you're checking each part of the body? So when checking the person from head to toe, we want to take note of how the person's skin looks and feels, any bleeding, cuts, burns, bruising, swelling, or deformities, any medical ID tags, Sometimes people have medical ID bracelets. And then their ability to move the body part without pain, discomfort, or dizziness.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic sample as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions, and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It was a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch, and I tripped over a crack in the sidewalk. I'm just so clumsy.
I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm going to feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm going to feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911. If your initial check of a child reveals that he is responsive and awake, get consent from a parent or legal guardian to provide care. If he does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. First, interview the child using age-appropriate language. It might also be necessary to ask questions of his parents, guardian, or any bystander. Use the mnemonic sample as a tool to remember the interview questions.
So what's your name?
Judah.
So Judah, tell me what's going on. Are you in pain?
My arm really hurts.
Ooh, your arm hurts? Does anything else hurt or feel strange?
No, just my arm.
Okay. I need to ask you a few more questions and then I'll help you with your arm, okay?
Okay.
Do you know if you're allergic to anything?
Homework.
He's allergic to amoxicillin.
Okay. Has he ever had a severe reaction to it?
No, just a mild rash.
Okay. And does he have any other allergies?
Nah, none.
Okay. Do you take any medications?
Vitamins.
No medications.
All right. So does he have any medical conditions?
None that I know of.
Okay. And when was the last time you had something to eat or drink?
I had a bowl of cereal for breakfast this morning.
Okay. So tell me what was going on right before you hurt your arm.
I was running on the playground and then I tripped.
Ooh, ouch. Did you hit your head when you fell?
No, just my arm.
Okay.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
I'm going to check you now for any other injuries. Do you mind if I touch you?
No.
Is it okay if I take a look at him, Dad?
Absolutely.
Okay. I'm going to start with your head first. Let's take a look. Okay. Does that hurt?
No.
What about this?
Mm-mm.
Okay. And take a deep breath for me, okay? And breathe out. Does it hurt to take a breath?
Mm-mm.
Okay, good. Does your belly hurt at all?
Mm.
Any hip pain? Okay, let me take a look at this leg. Does that hurt? How about this? Looks like you have a bruise on your shin. We'll take care of that too, okay?
It's okay, buddy. All right.
Can you wiggle your toes for me? Any pain or numbness or tingling? Good. I'm gonna take a look at this leg now. Does this hurt? Does this hurt? All right. Now wiggle your toes for me over here. Any pain, numbness, or tingling? Good. I'm gonna take a look at this arm now. Does that hurt? Any pain? Can you wiggle your fingers for me? Good job. Any pain?
No.
Okay. I'm gonna take a look at your injured arm now, but I won't touch the bruised area, okay? Does this hurt?
No.
What this?
No.
Can you wiggle your fingers for me? Any pain?
No.
Okay, good. Are you having any back pain at all? All right, let's take care of those bruises now, okay?
Okay.
Thank you so much.
No problem.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
So again, checking a responsive person, this time a child. Not a ton of differences between child and adult. Biggest thing is obtaining consent, either from the adult or, in the case of a child, obtaining consent from the parent or guardian. All right, we will stop there for the day.